Okay, guys, today let's talk about how to feed people who have difficulty swallowing. This special condition is called dysphagia. Dysphagia is actually difficulty in swallowing the food and the liquids. Now, this condition is common in the patients who have had esophageal or maybe neck surgery because of any cancer. They may have slow production of the saliva inside their mouth, or they may be on sedatives, or they may have neurological diseases. Now, keep note that the patients with dysphagia condition will have very a high risk of dehydration, of developing malnutrition or aspiration, etc. etc. Now, in this special case, we have to consult with a speech language pathologist so that he can give us the diagnostic test for the dysphagia that may be necessary. Also, remember that the dietitian works closely with the speech language pathologist in this condition to meet the patient's needs. Uh, and the food thickeners are added to the liquid diets like juices and etc. to slow down their passage into the esophagus. Now, why? Actually, this prevents aspiration. Believe it or not, it does. The care plan will specify the type and the amount of thickness to use and the special exercises and the approaches to use when we are approaching patients who have difficulty swallowing. Now, the special guidelines for providing assistance for patients who have swallowing problems. First of all, position the patient as upright as possible. The head should face forward, okay, with the neck flexed forward slightly. Reduce the distractions during the meal. If possible, go out of the patient's room. Limit the conversations. The patient should focus on eating alone. And if the patient asks, you have to prompt and feed it her slowly, offering small amounts and remind her to chew it properly. We are having a patient right now, and I've positioned her upright. And now let me give you an introduction of the food that she is going to eat, and after that, we'll proceed to a demonstration. She just had a tumor removed from her esophageal part, so she is having difficulty swallowing because of cancer. So now let's see. Let's look at the food which is to be given to the patient. Here we have juice. Here is a jelly. Here this is a risotto like dish. In India it's called khichdi. Here we have sago and here we have custard. Now the important thing to note that this liquid, this juice is not purely liquid. There is added thickener inside it. All the dishes which are prepared are produced with thickeners. As you can see the consistency of these dishes. Good morning, ma'am. It's time for the breakfast. Okay, I'm putting on the bed table. Okay, I'm helping you to put your hands on. I'm bringing the food. We have totally balanced diet. Is it okay? Can you eat it yourself? All right. Please don't try speaking while eating. We have different kinds of food here for properly balanced diet, and we'll give you your medications later. All right. You can start eating. I'll wait around, and after you finish, just give me an indication. I'll come back. Okay? Please. Please remember, keep your head straight. Head straight, please. Yes. Now you can swallow it easier. Please don't forget to move your chin up and down always. Okay? And don't forget to chew the food properly. It's recommended that you chew it 21 times, but it's your wish. Whatever you feel more comfortable. Okay? I'll be back. I'm sitting right here.